Each year, 1/2 of all working Americans admit to having back pain symptoms. In fact, it's estimated that 80% of the population will experience back pain at one point in their lives. And the sad thing is, many people just learn to live with it. Well, today, we're going to introduce you to one patient who decided to get her life back. And thanks to doctors here at Florida Spine Associates, she did just that.
I remember crawling in my apartment in agony, begging for relief. My husband finding me. I was in misery. I mean, complete misery. It's the worst feeling when you have pain and it's so unbearable. And it was unrelenting.
53-year-old Sherry Lubin was suffering on a daily basis. So much so, her back problems started affecting her personal life as well as her work life. She felt like her health was deteriorating day by day.
I couldn't do the little things that I used to do. Go to the grocery store, go to the gym, run, just clean the house, go out with my friends, sit down to a nice dinner without having pain.
Back pain is one of the most common medical problems, affecting 8 out of 10 people at some point during their lives. Some 16 million adults experience persistent or chronic back pain, and as a result, are limited in certain everyday activities. Sherry knew she had to do something and came here to Florida Spine Associates. She was desperate for help and desperate for relief.
Well, you remember this MRI? This is what we had before.
Yes.
Here you can see where that big bit of disc is squeezed out here and it's pushing on that nerve. And that's what was causing all the pain.
Sherry's condition is just one of many patients experience. Other common back issues include low back sprains and strains, lumbar degenerative disc disease, lumbar disc herniation, lumbar stenosis, neck sprain, neck strain, and osteoporosis.
One of the most common conditions we see related to the spine is a disc herniation. And classically, patients with disc herniation will have back pain, but they'll also have sciatica, right? So they'll have the pain that shoots down their leg. And a lot of times they'll also have weakness, or they'll have a foot drop, or they'll have numbness and tingling. So all that together really affects people's quality of lives.
At Florida Spine Associates, patient care is top priority. With over 50 years of combined experience, doctors and therapists give the top quality care to each patient. A team consisting of board-certified and fellowship-trained orthopedic spine surgeons and interventional pain management physicians, along with an extensive staff of medical professionals, all working together to give patients suffering from back problems the care they need.
Only a minority of patients that come in actually have surgery. The majority of patients we treat non-surgically. One common thing that can be done is steroid injections. So we'll often do epidural steroid injections to treat sciatica, right, the radiculopathy. And we have several interventional pain management physicians who are our partners who are fantastic at it. And they can really change people's lives and often get them to avoid even seeing me as a spine surgeon. And then we also offer physical therapy here. So patients that are deconditioned, they need to build up their strength. They go through physical therapy. And a lot of times that in and of itself will get people back in their game. There's many different surgical options, ranging from large reconstructive surgeries to minimally invasive outpatient surgery. So we tailor the appropriate surgical condition to whatever the pathology is. Patients that have large scoliosis, now we have computer-generated, customized implants to allow for a perfect correction of their alignment to get them back to where they should be. And then on the other end of the spectrum, we have outpatient minimally invasive surgery. In fact, the majority of my surgeries now are done at a surgical center. People go home within a couple hours after surgery. And I'm talking about artificial disc replacements, motion-preserving technology. You can go back home the next day. Fusions in the neck, you can go home the same day. Lumbar fusions, microdiscectomy, and we can really get amazing results in minimally invasive techniques.
Which brings us back to Sherry, who underwent surgery and is living life pain-free.
I'm doing great. I'm taking care of myself. I'm taking care of my parents, my husband, my life, back to running, back to eating good, back to enjoying the outdoors. I'm enjoying life.
It is so great to hear that Sherry's doing well, and thanks to the doctors here at Florida Spine Associates for having us. And if you'd like more information, just go to their website, floridaspineassociates.com, or check out our website, thebalancingAct.com.